Viewers, today we'll be talking about epilepsies and anti-epileptic drugs, especially for undergraduate students. You are quite familiar with the terminology epilepsies. What is epilepsy? So, it is defined as uh, that a clinical condition which is associated with sudden overactivity in the electrical uh, function of the brain, or it is a condition characterized by excessive neuronal discharges. A technical point to remember that is, if it is involved in the motor activity, then the what you can say, let's say this is the brain or the right hemisphere and the left hemisphere, you see purely diagrammatic, and this is a foci from which current of different amplitude is generated, you see. And if a nerve originating cell body here nearby is originating here and is going to innervate what you can say the upper limb, so it will have manifestation hairs. So it depends whether that the type of nerves, the type of area being innervated, and from where the foci is, where the focal point is. So from in certain cases, you see, from here the electrical activity goes down and involves the whole hemisphere, or it sometimes involves the whole brain. So this will be called as the secondary generalization, whereas only primary region, once it is the focus, this primary region, then it is called as focal epilepsy. We will be teaching you that later on. But what is important? Important is that it is a periodic episode. Periodic mean if you started here, what you can say, today a seizure is reported, and after a period, after a day, what you can say, after a week, after a year, so this period is important. Therefore, the periodicity is important in epilepsy. If it is reported for the first time, you can't say that this is the man is epileptic. So this is a technical terminology to remember. So epilepsy is it's a disorder of the central nervous system characterized by periodic episodes of seizure fits, and if it is in the motor region, then it is going to, there will be muscular manifestation, motor nerve manifestation will be there. But if it is related to the auditory nerves and audition, so there may be what you can say sometimes associated with auditory hallucination or visual hallucination. And now the thing, the speciality or the focus of this lecture will be now diverted towards psychopharmacology. But I will stop here just to tell you what is epilepsy, a disorder of the central nervous system characterized by periodic episodes of seizures, particularly in the motor region, and what happens, you see. So important is, as I gave you in the previous example, and I have given you after in my previous lecture, this is the millivolt. The current is plotted as millivolt, and that is a function of time. So what is important? If it is a function of time, time is plotted on x-axis, you see, and this is RMP, resting membrane potential of a nerve, and this is the threshold. This is the threshold, and if as in the previous example on the previous slide, this is a foci, focal point, and it is going to generate a current here, you see, and this current is going to stimulate a particular nerve as we discussed in the previous slide. So what happens if it is of enough amplitude reaching this threshold? So it's going to fire a nerve, and once a nerve is fired, you see, and it has to, now it has to, so it means it is associated with an action potential generation, and action potential of a nerve, particularly if it is a motor nerve, so it will be associated with a concerned skeletal muscle exaggerated response. So there will be motor activity, and the patient is reported, for example, if it is the right upper limb, so the patient attendant will say that my son is having this the upper limb, that is this uncontrolled skeletal muscle contraction, sometimes related associated with the jaw or the whole upper limb. And then if it is generalized, you see, it goes and involves both the hemispheres, so it becomes secondary generalization. So the history and the pattern, the clinical history is important, especially for the types of seizure and the onset of epilepsy. Now, having said that, once you reach, it is depolarization is there, so it's potentially generated. Now it has to repolarize, and if it has to repolarize, it has to reach this resting membrane potential again. And now, technical point to remember is if a 10 milliampere current is generated here, so and it is up enough amplitude to reach this threshold, so there are two treatment strategies. Number first, what is important that either alleviate the threshold, what you can say, let me carry this one, alleviate this threshold. So now this is what you can say, alleviated the threshold. You elevated the threshold here, then from here to here initially a current of 10 milliampere was here, you see, and it reached the threshold. And once you elevated the threshold, so now the current will start from here, it will reach here, but it won't reach here. This is called elevation of threshold. Elevation of threshold. This is important. The other important way is to carry this what you can say resting membrane potential to much more make it much more negative. And how it is possible? It is possible that in the beginning the resting membrane potential was, you can say, minus 70 millivolt. Let's say this was minus 70 millivolt, and now you carry it here. So this is minus 90 millivolt, minus 90 millivolt. So what is it? So now you brought this resting membrane potential from here, you see, from the RMP to minus 90 millivolt. So you make the nerve much more negatively charged. And what is important? In this, you see, there is GABAergic activity, GABA activity, plus excitatory. There is excitatory neuron, excitatory nerve, and there is a balance between inhibitory neuron. And you know GABA is inhibitory nerve. There is usually a balance. And if the GABA become weaker, the inhibitory become weaker, then the excitatory becomes stronger, and you may come across with a seizure or fits. So what important is from the treatment strategy point of view, to manage the epilepsy, no matter what is the type, either alleviate the threshold, as we talked about in the beginning, and certain drugs that's going to alleviate the threshold, like valproic acids, besides having inhibiting the transaminase enzymes, they also potentiate the GABA, and potentiation of GABA mean that, you see, if this is the cell and the nerve body, and here, if I make it on the surface cells of this brain, just for understanding, so GABA come and attach here, and it is having an inhibitory function. So what is important? Important is that outside the chloride ion, and there is sodium ion as well, so it triggers once the GABA come and attach with the concerned receptors, so it opens the chloride channels, and opening up chloride channels inside will make it much more negatively charged. And if in the beginning it was minus 70 millivolt, now it is minus 90 millivolt. So this influx of chloride inside to the nerve will carry this to the much more negatively charged. What is important now? A strong stimulus is required to reach this threshold. So sometime when epilepsy is relatively difficult to treat, or resistant epilepsy, so a clinician, a sensible clinician who would have a good clinical reasoning, will combine a drugs that is going to alleviate the threshold, that have potentiate the GABA, and of course you can combine so multiple mode of action that hyperpolarize the nerves, and hyperpolarization of the nerve, then a strong stimulus is required to excite this nerve from here and reach this threshold. So this is the treatment modality and strategy. Now we go on to the, what you can say, Uh, the next step, and that is important for you people, is that the etiology of epilepsy. There may be congenital defects, head injury, trauma, hypoxia, and the age is important in this case, especially hypoxia during what you can say during perturbation process or any other clinical conditions, and the head injury may be associated with RTA or even during the perturbation phenomena. So the patient may have a history. Uh, Infections, of course, meningitis, brain abscess, viral encephalitis, concussion, if there is a trauma, again, secondary to depressed skull, and of course, the fracture in the brain tumors. This is very important, especially, and the age is important, especially usually in adolescents, and at the age of 20 to 22 years, it is one of the main cause. That's the brain tumor. So the age is important. Age is important. Then the drug withdrawal, especially of the central nervous system acting drugs. The fever is important, especially in the children. Fever is important because it goes to febrile fits or febrile conversion. And then, of course, the hypoglycemia, which is sometimes undermined, and one should be photosensitivity is there and the photoepilepsy, but this is not so simple to diagnose. For example, a person with rabbit who is having a classical sign and symptoms of photophobia, phonophobia, and hydrophobia, that would be a different clinical condition. But photoepilepsy is one of the type of that as well. Now, what is important? Important is the triggering point, and regarding the triggering point, that is the fatigue, the stress. Stress is the case of hypermetabolism. We have already talked about that. You can follow me on my Professor Dr. Niaz lectures, and where the stress detail is there, where the negative feedback fails and the cortisol level is increased, and then the poor nutrition or malnutrition, alcoholism. Of course, the sleep deprivation. Sleep is important, but nowadays in this modern era, when we are using Facebook, WhatsApp chatting, and this sleep disorders and sleep deprivation is going to create problems, especially for the youth in this society. Now, what is important? Important is the types and seizure, and that will be very good to understand the treatment strategy as well. So there are seizures, you see, and in the number first, this is classified as partial seizure or generalized seizure. We have talked about that in the previous slide, you see, and uh, in regarding the partial seizure, number first is simple partial, as we refer to in the CLET model, that here is the foci, and it's going to affect that particular nerve which is being innervated by this. So the patient is alert in this case, and his consciousness is not affected. In the second case, that is a partial seizure or complex partial seizure, you can say complex partial seizure. So again, the focal point is there. It's also called focal epilepsy. Both of them are called focal epilepsy. The patient feels changes in the awareness, but he is uh, what you can say feels some complexity. That is why it is called as complex partial seizure. Though the patient is alert and he knows he's not unconscious at this moment. It's a technical point to remember. So the simple partial seizure or complex partial seizure. Then with secondary generalization that we talked about in the previous lecture, in the previous slides, that from this is going to involve the whole hemisphere. So this will be primary generalized followed by secondary generalized. This will be what you can say partial epilepsy followed by secondary generalization. On the other side, the big one that you see is the generalized epilepsy, and you see all the hemispheres are simultaneously, are the whole brain is involved, and it's going to affect. Uh, so the type is absence seizure, is grand mal epilepsy, atonic seizure, and tonic seizure or clonic seizure, you see, or atonic clonic seizure. Now, what is important? Important is this absence seizure is very important. It is in children, and usually, what you can say, it is underestimated. And if it is in children and underestimated, and the kid just stare for 2-3 seconds, and the school teacher or miss just have a slap on his her face, and it is not properly reported. So education of the school teachers are very important, and of course the parents are very important regarding the absence epilepsy. And the book says that if absence epilepsy is not managed properly, it can go on to classical grand mal epilepsy also. So that will be a separate story. And then grand mal epilepsies, you see, and the atonic seizure when the tone are not there. So what important is in the last previous slide I discussed that if you flood in the action, it is all about the action potential being generated in the nerve, you see, as we talked about, and that is going to innervate the skeletal muscle. So if this is this focal point and associated with secondary generalization, you see, and the silver is here. So what is important, and that current is going to, as we discussed in the previous slide, that uh, is going to uh, mm, reach this threshold, you see, and reaching this threshold is going to affect the the so you read from here, and so the treatment strategy is either alleviate the threshold as we discussed in the previous slide, or carry down this resting membrane potential to go down. So that is the treatment strategy in epilepsy, and these are some clinical reasoning, what you can say, clinical reasoning of and clinical situation of a patient suffering from epilepsy. As we discussed, that is a simple partial seizure, or is also called Jacksonian march or Jacksonian march epilepsy, and electrical discharge is there, you see. And what important is that this simple partial seizure is sometimes written in the books with Jacksonian seizure, Jacksonian march, or modal epilepsy. There is a complex partial. We discussed that in the previous slide. Then generalized tonic clonic, generalized tonic, atonic, myoclonic, absence seizure. This is very important, and awareness and education is, as we discussed in the previous slide. And this is another clinical condition, that is status epilepticus, or reoccurring an epileptic attack that is relatively resistant and difficult to treat is called status epilepticus, you see. And intractable epilepsies are usually managed. So how it is managed, we have talked about. So the seizure type now, and this is the drug recommended for the tonic-clonic drug of choice, or grand mal, carbamazepine, valproate, phenytoin, and phenobarb. And of course, these green are alternative therapy for simple partial or partial. That is again the drug of choice is carbamazepine. You can find valproate here. You can find valproate here, you see, in the tonic-clonic and the partial seizure. And alternatively, these modern new drugs, that is lamotrigine, have been adopted. Absence seizure, again, the treatment is ethosuximide, is the drug of choice, but alternatively you can use valproate, but nowadays clonazepam or rivotril. But its dose is very technical, and therefore physicians now are shifting towards valproate regarding absence seizure. What is important in myoclonic, again, valproate is the drug of choice, and in status epilepticus, diazepam is the drug of choice. And interestingly, everywhere you will find valproic acid. You will find valproic acid everywhere, whether that is febrile seizure. And in case of febrile seizure, the preferred route is the rectal route. This is important, especially to understand, because the patient is not cooperating in this condition. So MCQs maybe set in the paper, and that what is the drug of choice for absence seizure, and you will your answer, the correct answer is ethosuximide, and then the alternate choice is valproic acid or clonazepam. But what, in a nutshell, I can tell you that that valproic acid is being used in almost all types of epilepsy, including febrile fits and some certain other clinical conditions.